Hello, I'm Kimberley Monden. I'm a rehabilitation psychologist, and I conduct both qualitative and quantitative research. And I'm also the outgoing chair of the ASCIP Research Committee.
And I am Rafer Willenberg. I'm a spinal cord injury physician and a researcher, and I am the incoming chair of the ASCIP Research Committee. And today we are going to be talking to you about mastering the art of an effective scientific poster.
So here's a brief overview of what we will be talking about today. So first, we'll talk about how to set up your PowerPoint slide to be the correct size for your poster. Next, we'll discuss the necessary sections to include in your poster and also the guidelines for font size. We'll talk about the appropriate use of logos and graphics and also how to represent different types of research like case reports and qualitative research. We'll also discuss the new, sometimes preferred format for posters called the Better Poster. And finally, we'll show some examples of our own work of what to do and what not to do. So to begin, I first want to mention that when creating these slides, I created them in PowerPoint, and I also use a Mac. So when you're creating your slides, your toolbars might look a little different, or you might use a different program than I've been using, but you can always Google how to do a lot of these things in the program that you're using. So to begin, it's very important to ensure that your slide is set to the correct dimensions for the poster that you're presenting at the conference. If you don't do this, the scale and proportions of your figures, your text, your diagrams will be off when you print it in a large scale. So prior to each conference, typically you're sent an email with the required dimensions for your poster. So you want to adjust your slide accordingly. Again, in PowerPoint on a Mac, what you would do first is click Design in the toolbar, then click on Slide Size on the right-hand side of the toolbar, and this dialog box will pop up, and this is where you customize the slide and enter the specific dimensions for your poster in these boxes here, width and height, and typically you pick widescreen. So that's how you would set up your slide to make sure that the proportions are correct when you go to print it in a large scale.
And dimensions tend to be like a 3 by 4 foot poster or 16 by 9 dimensions. As for necessary sections to include in a poster, these are the things that are generally guided by your abstract or a research paper. So first, you will have your background and objectives, and this is going to give context to a poster. Then you'll need to talk about your methods, explaining what were the methods done for your study. Then we'll have the results or your data. Ideally, this is a visual representation of the results of your study, the main part of your poster. And then we should have conclusions. And optionally, you might have a section that talks about the impact of your work, such as clinical or impact on the research field. Then, to a minimum, if needed, you may be including references. Ideally, an abstract is standing alone without references, and your poster might be able to stand alone without references. But if you do have to include references, you would keep them to a minimum. And then lastly, you may need a section for disclosures. This could be funding sources or a disclosure statement, such as when you work in specific organizations. For instance, for this presentation included, the views expressed in this presentation do not necessarily reflect the position or policy of the U.S. government or the Department of Veterans Affairs. And that is my disclosure, as I am also a physician at the VA. All right, next slide.
And I will also mention for funding sources, they also have very specific language that they like you to use when you're publishing or presenting your findings. So I know DoD has very specific language, as does NIDLR. So that's something you'd want to pay attention to as well.
Good points. All right, here is an example poster. This is one that I made, and I'm just going to highlight all the sections that we just talked about. So I have the title, obviously, the highlight of what your study is, your names, affiliations, and then individual sections. So here, I don't really have a background section, but that is encompassed in this objectives section. And then the methods, which are the methods of what were used for completing your study. The results section, which is the main chunk of the data that you are presenting. Conclusions, which here are illustrated by bullet points, which I think are visually easier to digest than a block of paragraph text. And then in this case, there's a section included for impacts. Again, impacts that may be clinical or impacts for the field itself. And then for this study that I have in my poster here, the couple of references were really important to include, so I do have this section specifically of references, just with these two very important ones. And my disclosure statement, including a funding source, is included on the poster there. Go ahead. Next, let's talk about font sizes and fonts themselves. So there are two general types of fonts, a serif font and a sans serif font. Serif fonts have basically curlicues, like on the I's and T's. A sans serif font is without the curlicue. Sans is without. And so these are block text, such as shown here. And examples include Helvetica, Verdana, Arial, Calibri, Avenir, etc. It's to your advantage to use a sans serif font because they're visually easier to digest. They're easier to read, particularly from a distance. And as for font sizes, you should consider how big your poster is going to be and how far away the audience is going to be. So for a standard poster, it might be 3 feet by 4 feet, and a standard viewing region might be 5 feet away. Some conferences have posters that are huge, like 4 feet by 8 feet, and you might have space to have standing with people 8 feet away. But for general guidelines, I'm going to stick to the 3 by 4 poster that's being viewed 5 feet away. And for those sizes, you would want your title to be very big, grabbing your attention from, I might exaggerate a little by saying across the room. And so your title should be at least something like 72 point. And then your names, these are highlighting you, your contribution to this work, and you want people to remember your name as presenting the poster. So the font should still be big, something like over 52 point, but the affiliations are not as important as your names and don't have to be as big. So perhaps 32 point. Then for the section headings, these should probably be at least 32 point, but the block of text or the body text within, that can be smaller down to 24 point. And then for your figures, you also want these legible, something big like at least 32 point. The labels within the figures can be pretty small, perhaps down to 18 point, and that's getting into the range where a person might have to step in from 5 feet away to be within 2 feet away, something like arm's length away, maybe squinting to be able to see that text. Legends might be something like 24 point, and then references, again, pretty small compared to where you want the attention to go for the rest of your poster. Generally, these can be down to 20 point. So a take-home point is that the smallest the text that's being used might be down to 18 and 20 point, and that's really when someone has to step in closer to make out what that text is saying. And in talking about font size and image quality, we also should mention print resolution. When you are printing images, for it to look crisp, the image should be printed at least at 150 dpi or dots per inch. You can go up to something like 300, but that might just make a bigger file size or bigger print burden. So a good rule of thumb is 150 dots per inch. And an example, again, here's highlighting one of my prior posters, and I'm pointing out all the different font sizes that I used for this poster. So for the title, the font is huge, in this case, 88 font, 88 point. The names are pretty big. I stuck with the 54 point and 32 point for the affiliations, leaving attention to the title and your names. Then for the section headings, like objectives and methods, the point is down to 40, and the text within the sections, the body text is 32. Then in here in my methods section, I have a bit of visual with text in the visual, and this text is down to 24, giving you a sense of what that looks like. Some data I have highlighted here is being 32 point. This is data within a table. And axis labels, in this example, I have them as 28 with actual data labels being as 20. So for this size, someone might have to step in closer to be within an arm's reach away to make out what that number says. I have a little bit of text that's somewhat smaller for the tick marks on the axis. These are down to 18 point. And my affiliations, I'm sorry, my disclosure statement is down to 20 point along with the funding disclosure. And references, in this case, they're a bit bigger, 28 point, because the two references that I included for this poster were really seminal, very important to include for what my study was based on. Go ahead, Kim.
Right. So next, I'm going to talk a little bit about using logos and also images. So when you're using logos, it's really important that you use your institution's official logo. And to do this, you typically have to go through your marketing or communications department. And this also is the case for any logos you use for your funder. So you want to make sure you go directly to your funder to get their logo. So we all know it's much easier just to Google the organization and take a screenshot of that logo and use that. And then we also all know that once you print that out on a poster, it doesn't look very nice. And it's also not allowed. You have to use the official logo. And some funders are very particular about this as well. And they may be at the conference. So you want to make sure that you're following their rules. So as tempting as it may be, don't cut and paste from Google. So this is an example of me going online and cutting and pasting from Google versus emailing ASCIP and asking them for an official version of the logo. So it's pretty obvious that the top logo is from ASCIP and the bottom logo is the one that I grabbed off of Google. And so you can imagine if this is blown up on a giant poster, how grainy that's going to look. So don't do what I did on the bottom and do what I did on the top and reach out to the organization and get the official logo. And it's also important to know that you can't alter the logo or the image in any way. So say you are using a purple color scheme in your poster. You couldn't change ASCIP's logo to be purple unless ASCIP gave you permission or they happened to change the logo to purple for that year, which I think they did one year. So you can't just go, you can't take the tagline off the bottom. You need to keep it exactly how the logo is. So when you're using images from the internet, you need to make sure that they're under a Creative Commons license or that you have permission to use them. You can't take images off the internet. It's very easy to just go and Google, find an image and say, I'm going to slap this on my poster or in my presentation. But when you do that, it's actually plagiarism. So you need to make sure that you have the appropriate permission to use the images that you're putting in your poster. So there's a really easy way to do this. So when you're Googling an image, here again, I Googled spinal cord image. And this brings up all of the images of spinal cords on that Google can find on the internet. And these are both licensed and unlicensed photos. So to filter that out, again, I'm using a Mac, so this might look different in another program. I was using Chrome. So this little tools, there's a little tools menu on the right-hand side of the toolbar. So you want to go ahead and click on that. And that will bring up this drop-down menu. And here I didn't click on Creative Commons license, but that is what you would want to do. And you will get less images than what you see here. And typically not the ones you really, really want. But unfortunately, those are the ones that you have to use, are the ones that are under license. So that's the way that you can go ahead and find them in Google. Also in PowerPoint, when you go to insert a picture, now you can pick to find images online, and those are all licensed. So it's becoming more and more easy to get licensed images, and there really shouldn't be a reason to be plagiarizing images this day and age. It's easy enough to filter it out and also find ones for free that you're allowed to use. And with that, I'm going to pass it back to Rafer to talk about how to show your work on case reports and posters.
So some of you might be in situations where you have a case report that you are going to present. The case report is likely to have an abstract that you submitted to the conference, and that abstract, like for other studies, is going to be your guide. So some of the things that you're including in your poster would be the same that you are including in your abstract. And I want to focus a bit on things to include and not include. So you have to keep in mind that you want to protect the privacy and personal information of the patient or subject of your case report. So you will need to include the minimal amount of information that can lead to identifying the person. The question to keep in mind for yourself is, could the information included make it likely that the reader could identify the subject or patient? So with that in mind, there are many things to not include. One is specifically do not include personal health information, or PHI. That includes things like a person's name or city or county of residence, because that is too restricting in being able to provide information that can lead to identification of a person. Likewise, don't include a person's initials. Don't include things like the date of injury or the date of an event or a date of admission or discharge, because that's too much information that can lead to identification of a person. If you need to include some reference of time, you can generalize to a year. Again, only include it if you need to. In general, do not include patient images. A specific point is don't include a person's face, as that would allow recognition of a person, and don't include things like identifying tattoos. And if you are going to include images of patient, you must have the patient consent. In fact, for many case reports, or in general, you may need patient's consent anyway. One more point of consideration is that it's possible to include combinations of different pieces of information that end up being too specific, because it can lead to possible identification of the person, the subject of your case report. So here are 3 examples. One is a 101-year-old man who lives in zip code 90210, which is Beverly Hills. Well, the zip code is already too specific, and in the combination of that with a 100-year-old man, in which there are not very many of them, that could lead to potentially identifying the person who's the subject of your case report. Likewise, a patient who has high tetraplegia from a rare disease and has 4 children and works as a seamstress. In this case, you didn't mention location, you didn't mention the age of the person, but the combination of a rare disease with a specific level of spinal cord injury and these additional details about the social life and her work identifies this person as too easily identifies this person by potential from the reader. And finally, last example here is a woman in a car accident in October 2009 was admitted with spinal cord injury to the ICU at Hospital X. All this combination of information, the date, the month of injury, the hospital that they were admitted to, it was a woman and it was she was in a car accident. This combination of information makes it too likely to be able to identify the person that the case report is about. All right, next slide.
So before I go to the next slide, I do have a question for you.
Please.
So what if you have a picture that doesn't include someone's face or any identifying markings like tattoos? So a picture of just an arm or a leg, would you need the patient's consent to include that?
I would say in general, yes. So you are taking a picture of a person, and for including that in a publication or poster, case report, you should have that person's consent. There are some pictures, such as, let's say, inside the body, so imaging, MRI, CT scan. These are not really identifying of a person, and so those really do not necessarily need consent. But in the case that you might be writing a case report about that person or putting forth a case report about that person, you likely would need consent anyway. And for a picture inside of someone's body, such as a person who's having surgery and you're just showing parts inside the body that are not identifiable to anyone, it's the same situation where you're likely going to have consent of the patient for having a case report about them, but you would not specifically need consent for those images. But again, you're already going to have the patient's consent for making a case report about them.
So err on the side of caution.
Exactly, err on the side of caution.
All right. So I do a lot of qualitative work, mixed methods work, quantitative work as well. And for anyone who's done qualitative work, you will know that putting together a poster of your findings can be pretty challenging. And that's because your results are so text heavy. So there are some tips for putting together a poster with qualitative research. What I've really noticed is any pre-existing templates that are out there, either in PowerPoint or ones that you find online, they really don't work. So you really need to just start with a blank slide, a blank canvas, and start from scratch. And think about your key points and the message that you want the readers to take home. And as I was doing a little research on this, and I've done this in some of my posters as well, sometimes it could be hard to incorporate graphics into qualitative research, and one way to do so is using these speech bubbles. So I saw an example of one online last night where the person used speech bubbles that looked just like this. It was the majority of, I think, like 3/4 of her poster all along the side. And it was a really great way to illustrate the participants' quotes. So you just have to be a little more creative and thoughtful about how you present your results so that it's not so text heavy. So I'm going to go through a few examples of some qualitative posters that I've created. One showing a not so good example, and the other one showing a little bit of a better example. So a work in progress. This is a poster I presented back at ASCIP in 2013. And as you can see, I used a pretty common template. So it has a lot of those same content areas that Rafer was talking about earlier. We've got the intro, the purpose, the methodology, participants, results, conclusions, but the results, which are the quotes, really get lost in all of the other text. So it's really hard for somebody walking by, maybe glancing at the poster, to know what the takeaway is. in hindsight, what I probably would have done is reduced a lot of this other text and left this whole side to do some graphic with the quotes to make it really stand out. But I didn't know that at the time. So this is a poster I presented at ASCIP 2 years ago. It's the first time I ever presented a poster in vertical format, and I did not like it. I preferred the horizontal format. This kind of broke my brain. So this was qualitative research. In this study, we used expert panels, so focus groups essentially, and I used a rapid analysis approach. So it wasn't as deep of a qualitative analysis. So what I did here was really kind of pull out the themes and on the bottom, highlighted in bigger font and with the maroon background, really the takeaway message. So again, as opposed to using all of those quotes, I focus more on the themes to make it a little less wordy. And this was actually one of a 3-part series of posters. So that's why it has aim 1 here identified, because the next 2 posters had the other 2 aims clearly identified. So that's a few examples of how I've presented qualitative research. And then when I get into this next topic of the better poster, I'll show you how I've done qualitative research in that format. And I think it lends itself really well to this format. So within the last, I think it was 5 to 7 years, you've probably heard of this idea of the better poster. And you may even have been at conferences and seen some posters presented this way. And the idea of the better poster is to minimize the text and really only present the essential points and display the main findings front and center of your poster. So being the green part of this example poster here. So using this format, they also recommend you include a graphic of some type in the middle as your focal point. And really this format is meant to foster conversation and make it easier for people who are just walking by and maybe don't want to stop and talk to know what your takeaway message is. And hopefully it's intriguing enough that it draws them in. So they really should be visually appealing and eye-catching, which makes more people likely to stop and engage in conversation with you so you can tell them about your research. So this helps, I think, posters stand out of the pack a little more. And I can say from experience, I spend much more time on these posters than posters where I'm allowed to put more information. So it requires you to be more creative, and it requires you to really think about how to translate your findings and focus on what's truly important in your research, which I think is an important skill. And so you can go to this link here. It's to the American Psychological Association. They have some more information on the better poster format. You can actually download this template right here, which I've done in the past. It was very helpful. And when this sort of idea came out, the idea was that the scientific poster is broken and we need to fix it. And this was the solution. And NPR actually covered this story about how, we needed to fix the way we were translating our science. And a link to that NPR story is on this page as well, if you're interested. So here's some examples again of my posters over the years using this better poster format. This here was a qualitative study again. So you can see I highlighted front and center a quote from one of the participants. And again, the quote that I picked out very intentionally was one that really summed up the findings of the study, and then used a graphic to kind of be the focal point and very minimal text along the outside of the focal point of the poster. And to me, like I said, this format lends itself really well to qualitative research, I find. This next poster is an example of a quantitative study. So this was a pilot clinical trial of HRV biofeedback. And so in this study, we made the focal point our takeaway finding, which was that HRV biofeedback actually works with people with high-level spinal cord injuries, which people thought couldn't happen. So we also used a quote here. It was a pilot study, so we got feedback from patients as they were going through the protocol. And so we used this quote to reinforce our finding that people actually took something away from the biofeedback training and thought it was useful. And then, of course, a small little graphic here. We had our funder's official logo from the Craig H. Nielsen Foundation, and then also tried to minimize the text by using different graphs and diagrams on the outside of the focal point.
I like this poster.
Thank you. I can send you the template. All right, some other general examples of posters I've created in the past, just to give you a sense of different layouts. So this one is more of a traditional poster. I'd say it looks very similar to the one that Rafer presented earlier. Has it has all of those specific content areas covered. And this was a quantitative study, but I think we did a good job here in combining the text with figures and tables so that it wasn't so text heavy.
Yeah, and let me add that even the color scheme here, you can see the thought that went into it and the cohesiveness as you have the section headings with this cobalt blue color, which complements the background, complements the ASCIP logo coloring, and it's within also matching your Craig logo, which I think was your primary affiliation. So it's a pretty
Yes,
cohesive color scheme.
thank you. Yes, at that time, that was my primary affiliation. And maybe people have known this for a long time and I'm just late to the game. But when somebody showed me where the eyedropper was in PowerPoint, so when you go to pick a color, if the color you want is not there, there's an option to say like pick additional colors and there's a little eyedropper. And you can take that to anywhere within your PowerPoint, on the internet, another document, and click on the color you want, and it puts that color in your palette. And so it's really easy then to match it to your logo or whatever color you want to match it to. So that was a game changer for me. This is a poster we presented recently back in February. Angie actually presented this poster. It's a very different format, more of the better poster format, I think. Not very text heavy. And what I liked about this poster is it really seemed to draw people's attention. Angie had a lot of people coming by to talk to her about this poster. She also included the QR code to more information about the study, which I think was really helpful, especially when you're going the better poster route where you have less information in front of people. And so this was one that, again, we kind of experimented with different designs. It's a little more minimalist, but I think it did the job really well because it engaged the audience and we got a lot of traffic to the poster. All right, I'll hand it back to you, Rafer.
Okay, so for some people, particularly trainees, you may be attending conferences where there may be a poster competition or poster judging. So I want you to think of how might your poster be judged? And I pulled out three major themes for what I think are important for poster judging. One is organization or flow of the poster. So when someone is looking at the poster, does it make sense or do they easily get lost? That should be something that's apparent from your poster. And then another major point, which is I think the biggest point of your poster, is that of communication. And a poster is an opportunity for visual communication. So there's a major focus on visualization. This includes illustration of data or concepts, the main points of your study. And what also matters are aesthetics or is aesthetics. So a pretty poster is nicer than an ugly poster. Beyond that, objectives should be communicated clearly, and this is easily guided by your abstract. Similarly, the findings and conclusions of your study should be communicated clearly, also guided by your abstract. And then as the final main theme that I pulled out is that of study rigor. Now, your study is already done or done to the point that it is by the time you're making the poster about it, but the study rigor should be apparent in your poster. And the study rigor is also going to be in your abstract of what your study is about. All right, moving on.
Yeah. And that brings us to the end of our presentation. And we want to thank you for watching. And we hope that this content is helpful as you build your posters. But we also want to remind you that most importantly, poster sessions are about networking. So it's okay to have a little fun. It doesn't have to be all business. They tend to be in a more casual setting, a more casual format. There's often cocktails, as you can see in this picture, maybe hors d'oeuvres, and it's a chance to get to know other conference attendees and people with similar research interests. And you can do some really great networking among other professionals. And so have fun with it.
All right,
Thank
thanks
you.
everyone. See you at ASKIP if you go there.